All right, well, we're going to go ahead and get started. Today's webinar, we're going to be presenting what to expect when you return to work. We plan an hour for our meeting today. It may not take as long, just an FYI, but we will plan to go from 11:30 to 12:30 today. Our two presenters, those of you who were with us last week will remember TC and Joe. Those of you who are with us for the first time, welcome. TC is a former flight paramedic, technical rescue specialist, and biohazard recovery and restoration field supervisor. Joe, who will be presenting first today, is a former paramedic, technical rescue specialist and rescue instructor, and a biohazard recovery and restoration field supervisor. So with that being said, I'm going to go ahead and let Joe take over the presentation.
Nathan, I just want to check with you real quick. Are you hearing the doorbell?
I am, and for some reason, the chiming when people join is enabled today. I'm not sure why. We're just going to have to kind of roll with that one.
Okay, I didn't know how to turn it off, so I apologize to everybody. I also apologize for my neighbor who is cutting his grass right now, but that's the joys of working from home.
Absolutely.
Right, let's go to the first slide, what we've learned. Again, I'm Joe Woodman from Life and Safety, and we've been working really hard, kind of redirected our focus really from the standard workplace safety and OSHA compliance and this and that to this kind of unexpected turn of events that, I mean, 6 months ago, if I'd have told you that you'd be nervous to stand in line with people, that you're not supposed to shake hands, and that you can't just go to a restaurant or just go driving, you'd look at me like, what happened? But here we are. So we're all trying to adapt and do the best we can in this circumstance, and Life and Safety is here to help. So as part of that, we were approached and asked after the last session to kind of cover some of what we've learned, what we've done, and just give some more information on safety this time and everything that we're dealing with. Life and Safety is not immune to the turn of events. We found out how well prepared we were and how poorly prepared we were in some respects. Businesses tend to specialize in one thing or a small handful of things. That's what makes them efficient. That's what helps them make money. And when you throw variables into that aren't expected, you can kind of get train wrecks. So we've had to adapt our model from going out to clients, doing a lot of job site work, training sessions at client sites or at our office, to more distance learning, using our learning management system, phone calls, web meetings. And I think we've accomplished that. We've done very well with that, mainly because we have these pre-existing relationships that make that possible. It's harder to start from scratch. But we're not the only ones. Many businesses are struggling to figure out how to get customers right now when they can't come to you, how to serve customers when you can't go to them. So we also learned that the medical knowledge we have, TC and I have, rather than being kind of a nice thing that sits on the shelf that we don't use all that much in our new careers, all of a sudden it's front and center. And it became apparent to us and to the people we were working with that, hey, you guys need to do a little more here when it comes to this, because you can help a lot. So we're front and center now. We're trying to do our best to make a difference now, instead of being on the front lines and on the ambulance, in the helicopter, whatever. We're now doing this as keyboard warriors, if you will. Our experience in handling emergencies in the field and handling administrative, like incident command situations and other things related to that, also apply, because this is a very complicated situation. It involves bureaucracies, it involves legislation, regulation, agencies, alphabet soup stuff. It's kind of crazy, and that's like the world that we've lived in. So we've been sent places where nothing works. There's no power, there's no water, there's no nothing, and say, hey, go solve the emergencies there. Let us know what you need. And that's really good training for what we're facing right now. Is hopefully it won't get that far, but that's what we're looking at. And finally, much of the work we've done has been around bloodborne pathogens, or what's called OPIM, or otherwise potentially infectious material. So we're used to it. We understand it. It's a known quantity. Even if it is a little scary, it's something that we kind of innately understand. And that's not the same for other folks that have never been around, say, a patient with tuberculosis or HIV or coronavirus. It's frankly, it's terrifying. It's an enemy you can't see, that you can't fight with anything you've got necessarily on your person or in your house. And you don't know whether it's going to get you or if it's already gotten you, because the infection period is so long. Go ahead and hit the next slide, Nate. Slide, please. There we go. Okay, so our first topic from our little advertisement, our little blurb, we said we wanted to cover safety measures that are in place or that have been put in place for the general public. Next slide. In order to understand what safety measures are needed and which one works, I feel like you have to understand the process, the principles of infection control. And without getting too far into the weeds in terms of healthcare specific stuff, I'm going to cover this from a civilian, regular old Joe standpoint of this is how it works. So the threat is this virus. And this virus doesn't wander around on its own, sneak into your house or whatever by itself. It rides on people, or what people off-put in terms of droplets or whatever, what they touch, what they cough on, what they sneeze on, how they breathe, this and that. So if you understand the process, you can interrupt it anywhere along the way. And any interruption gives you an advantage or a chance to stop the transmission of an infectious agent. So looking at the graphic on the right side of your screen, an illness, an infectious agent needs a susceptible host, someone or something that will allow it to grow and survive, and be its legs, if you will. Then, of course, you need the infectious agent, and finally a reservoir, which in our terms, the reservoir is right now is people. Perhaps early on, the reservoir was bats, the susceptible host and reservoir. In the case of just looking at something, maybe blood, a reservoir could be a puddle of blood on the ground. But in here, we're going to kind of talk about the population as reservoir. So you have to have a means of exit from that reservoir. So that means of exit, a portal of exit relates to also to the mode of transmission. Someone can have it in them, but if they don't output, if they don't cough, if they don't sneeze, if they don't spit a little bit when they talk, or some of the other things that happen, it's going to stay inside them for the most part. And finally, to finish the circle, the susceptible host has to have a portal of entry. So if you deny that portal of entry, the virus is standing outside the window going, hey, let me in, and you're just standing there shaking your head, no thanks. So if you've got good PPE, if you've got distancing going on, those are things that can deny an infectious agent a portal of entry, and thereby you shut off the process. So why is this important? Well, you need to think about transmission and also populations, people moving. Epidemiologists study this and work on this all the time. They apply highly specialized knowledge to help control and even kill infectious disease processes. And this is all part of what epidemiologists do. Next slide, please. I had to take a sip of coffee after saying epidemiologist 3 times because that's a big word. All right, our second topic, what policies have been created or updated to protect employees? That's, there's all kinds of stuff. Some of it's really hokey, some of it's very good. and deserves sharing. Frankly, all of it deserves sharing, but not all of it deserves emulating. So let's move to our next slide and talk about some specifics. A few weeks ago, I was contracted to work with a manufacturer, an auto parts manufacturer locally. Their safety officer was out for a week and they needed a fill-in, and I went out and did that job. And in the middle of doing that job, the COVID issue began to affect the workings of the plant. There wasn't anybody sick in it, but they became very concerned about how to maintain productivity, how to protect their employees, how to react and roll with this sudden process that was happening and that they really couldn't plan for. This was really, for the most part, something like this was not anticipated or viewed as a really likely thing to happen. So they said, "Hey, Joe, we know you're the fill-in guy, but what do you think about ways we can make a difference here?" And I said, "Well, actually, I have a good background in EMS, in emergency healthcare in the field. I'm no doctor, but I've been to college. I've got biology and anatomy and a whole bunch of stuff running around in my head that might be useful for you. So let's sit down and figure this out. You know your process, you know your environment, you know the variables there, but I come from a 30 years of, if it's going to go wrong, it's going to go wrong in front of me, and I'm going to be called to help fix it, and we've got to adapt, improvise, and overcome. So let's sit down and talk." And that's what we did. So what complications did we face? And these are illustrative of complications that any business can face. You know, you may be a baking company and you can't use certain chemicals at all around the food, or you may have to deal with clean rooms where you can't do that otherwise. So specifically in this example, the first question they asked was, well, what can we use to clean? Because we can't get anything. Go to Walmart, go to CVS, go to your major business supply places, Sam's, whatever, and try and find bleach. Try and find Lysol wipes. Try and find the go-to things that everybody was thinking about. If you didn't think ahead, if you didn't have a stockpile of this or a reasonable amount, you were well behind the 8 ball. And that's where they found themselves in terms of this. They couldn't just go out and buy a pallet of wipes. I said, well, let's table that for a minute and let's talk about, let's study the needs, the process, what needs to be cleaned, what needs to be controlled. Then we'll get to the chemical. So we watch the employees work. We notice what they touch. There's a name for, I don't know, it's kinesthesiology or workplace efficiency studies, but we kind of did that informally, and we saw what needed to be cleaned, at least periodically. And we realized that not only did it need to be cleaned, but it needed to be a simple, safe, and convenient process for the employees. And the employees also had to be taught why it was necessary, how to do it properly, and then somebody needed to follow up on it. So that's what we did. We handled all this. And once we got to a point where we realized we could do it, then we were back to what chemical could we get that wasn't going to wreck the finish on these parts. And the list was very short. I happened to realize that several of the stations had spray bottles of isopropyl alcohol on hand, and they would use that and microfiber cloths and buffing tools to help remove little imperfections in the finish or to clean up smudges here and there. And I was like, hey, isopropyl alcohol works for killing COVID. Let's explore that. Not only was that totally compatible with all their finishes, but they happened to have a 55-gallon drum of 100% isopropyl in their stock room that was nearly full, that we could dilute to the right solution for this task, and not totally wreck their buffing process. So thankfully, the solution was right there in plant, and we didn't have to come up with something else that was more creative. Not only that, but we also interfaced thoroughly with their contract housekeeping provider to make sure that their chemicals were being properly applied, that their staff was informed and following the procedures. We kind of tuned everything up. And when you put a laser-like focus on something like that, you become much more effective. And that's what we did. So again, our solutions were, we located and properly packaged the right cleaner for the job. We watched the workers work. We showed them what to disinfect, how to do it. And we not only did the hand tools that they use collectively, but we also talked about doing forklifts and garage door controls, battery chargers for the forklifts, all these things that people touch without ever thinking about, like if they had elevators, they did elevator buttons, all these things that had to be done. And finally, we made sure the employees understood the why behind what we were telling them, because we couldn't prepare them for every eventuality. They had to know at some point that, oh, wait a minute, maybe I should wash my hands before I put a dip in the break room, or maybe I should not just cluster up with everybody at the table at lunch. Maybe we should stay a little distance apart. Next slide, please. So the third topic that we were asked to address was, how can you return to work with confidence? You've got an enemy you can't see that may lay dormant in someone while it's growing and multiplying. You can catch it from somebody else without even knowing it, and you may be highly susceptible to it and might even die. That's not a fun thing. That's not something any of us wants to mess with. So there's a great deal of fear and uncertainty out there. The best way to fight fear and uncertainty, and TC and I know this intimately, and I guess anybody that's been through the military does as well, you train. You train, you practice, you work hard, you troubleshoot, and you get stronger through knowledge and teamwork. So that's really the solution here that seems to be working, is people are hungry for knowledge. They're looking at the easy things to solve first, the hard things to solve next, and kind of changing everything to adapt to this. Next slide, please, Nathan. So let me again use an example from the healthcare industry. CDC has guidelines on infection control principles that apply here. So I don't know if anyone listening is actually in the healthcare industry, or you're probably come to us because of a business interest. But hey, infection control is paramount in hospitals. There are whole departments that do nothing but work on infection control. So these folks know something about it, and they have something to offer. So there are two primary tiers or divisions of infection control. One is just standard procedure, what's also known as universal precautions. And the second one is transmission-based precautions. Transmission-based precautions are used when you have a known source. Universal precautions are used for everybody, kind of just in case. So let's look at standard procedures. Next slide. So this works for COVID. If you apply this, this provides a barrier to that portal of entry. This can cut other processes of that infectious disease chain of transmission. So this is strongly recommended by the CDC. Excellent hand washing. Washing long enough, washing thoroughly, and washing often. We touch all kinds of stuff. The bacteria, viruses get on it, and then we transfer it to other parts of our body where we may touch it later and it gets inside us. That's just the simplest way I can think of to put it. If you can't, well, in addition to excellent hygiene is proper PPE. So if you're using gloves, make sure you take them off properly when you're done, properly dispose of them, and wash your hands afterwards. Because I read somewhere, I can't cite the source, but that these nitrile gloves and other gloves can lose some of their abilities over an extended period of time. Like if you wear the same pair of gloves for a whole shift while you're doing something, I wouldn't say healthcare, but other things, they can become damaged or leaky or whatever. So the standard for everyone when they use gloves for personal protective equipment in the healthcare field is you always wash your hands afterwards. Not just gloves, but if you're dealing with splash hazards, a face shield and eyewear. I've been studying articles left and right. Gosh, I used to read the news and maybe look at videos, and now about all I'm doing is studying journals and reading articles and scholarly things. A face shield combined with a face mask is much more effective than one or the other. The face shield can provide you immediate droplet protection as a barrier, and the mask can also help keep you from contributing to the problem, as well as perhaps filtering some of this material out. So together, those two things are good. Excellent respiratory hygiene and cough etiquette. Sneeze into something and capture that. Cough into your armpit, your elbow. I'm sorry, and make sure that you're not a vector for other people, that you're not spreading that. When this says assure appropriate patient placement, we're talking kind of the medical equivalent of social distancing. You're not going to put an infectious patient in a ward with other patients that aren't infectious. Just like if you have someone who's potentially sick, you're not going to stick them in the middle of a waiting room full of people shoulder to shoulder. So social distancing, respecting air changes, good ventilation, giving the droplets that might be floating around in the air a place to land and time to land is all important. That's what this is talking about. And finally, properly handling and cleaning items that may be infected and disinfecting the environment. Again, you are breaking the chains of transmission by doing that, and that's very important. All right, let's go to the transmission-based slide. This one is about when you have a known infectious person or an agent. So if you're treating a COVID patient in your wing at the hospital, you're going to have them in an isolation room. You're going to have specific staff assigned to them. You're going to have excellent PPE, good ventilation, all that stuff. How does this apply to business? You're probably not going to let somebody that you know is a transmission-based risk into your business or to come in and work. But let's say it happens while they're there. They suddenly develop a fever, or they come to the boss and say, man, I tried to work through this, but I don't want to get sent home. I got to work. I think I have a fever. All right, that changes everything. So how do you react to that? You use transmission-based precautions. You're going to clean up after the fact. Don't let that employee wander around and go visit the rest of the staff and say, hey, by the way, I'm sick. Make sure you clean their workplace, keep them away from other employees, have them go get checked medically, but excellent cleaning and reconstructing where they've been and who they talk to are important, as well as letting the powers that be know what's going on. The rest of this is fairly detailed. I think I've been talking long enough on this slide for you to be able to read most of it. So let's move on to the next one. Infection control point number 3, education is critical. If all you tell people is, hey, this bad virus is out there, wear a mask, you'll be fine, you're not doing them much of a service. Because they may wear the mask forever. They may not clean it. They might not replace it. They might pick the wrong mask. I'm seeing recommendations for just put on a bandana or a t-shirt. Something's better than nothing, maybe, but most of us know that the porosity of what you're breathing through is going to determine what comes and goes through that cloth. So it's like a screen on your porch. You're going to get air movement. You might even get no-see-ums coming through there and biting you, as opposed to something that's more appropriate to keep those threats out. The same thing is true for infection control and masks and things. So stay current on the information that's out there. Make sure your employees know, because they might need to make judgments on their own about what to do if it's not covered by a policy. Let's go to the next slide. Modify existing practices. So before all this, nobody had a problem really standing in line, waiting at the movies or waiting to vote or do whatever. But now, if you get too close to somebody, you get a dirty look, perhaps rightfully so. So things that respect the chain of transmission, that recognize how to shut that off, how to interrupt that are important. Frequent cleaning of break rooms, limitations of gathering employees, disinfection of communal tools, computers, touch screens, time clocks, things like that. For instance, in my industrial company, the employees were freaked out about the time clock because you had to touch it and punch in your number. And they're like, we're going to get COVID because we have to do that twice a day. and they wanted it wiped down with bleach. They wanted bleach wipes at the time clock. And I was asked my opinion on that. And I said, well, your time clock might last or it might not. How about we clean the time clock with an appropriate cleaner periodically during the day, but tell the employees when they punch in, go to the bathroom, wash their hands. And when they punch out at the end of the shift, punch out, go to the bathroom, wash your hands. It just makes sense. And something like that is not necessarily thought of. People just want to wipe and clean and feel safe. So you might have to modify your processes. Look large and be thorough. That's the best advice I have. Next point, please. Looks like the next point is Mr. TC. Are you ready?
Hey, thanks, Joe. Hey, good morning, everyone. Thanks for joining us once again. As Joe just discussed, I mean, a lot of our topics are going to overlap, but I'm more focusing on continuation of our discussion last week on regulations as far as ocean workplace safety. As you can see, we're going to be talking about PPE, HAZCOM or hazardous communications, the bloodborne pathogens and infection control, general environmental controls, the general duty clause, and recording and reporting. So in PPE, next slide, Nathan, please. There are several standards that we are needing to follow and adhere to. So in 1910.132, this is our general requirements. And as of yet, there haven't been any real published interim changes that may or may not occur. OSHA, bless them, they are in the thick of this with us as well, trying to figure out what's the best thing to do to keep our work staff and workforce safe and healthy. For eye protection, since our last webinar, I've had a few questions from clients. And with eye and face protection in 1910.133, this is more directed at your safety glasses, your face shield, splash guards, things of that are more about the chemicals we're using to clean. So it's kind of a cultural thing. If we have a bottle or a can of Lysol and we're using that Lysol to clean and disinfect, that's household. We use that at home. We don't think, oh, wait a minute, no, this is a chemical. I still need to be wearing my eye protection and face protection. So I would encourage some review of this and make sure that you're adhering to it for any practices. Obviously, evaluate your workplace and make sure that you have those supplies and capabilities on hand. And perhaps you have a shortage of a face mask shield. Maybe adjusting to using a wipe instead of an aerosol or a spray. Maybe that's something that you could do. Just give it an evaluation and a hard look and see if you need to make some changes there. Similarly, 1910.138 with hand protection is also more about the chemicals that we're using for your processes of disinfection and protecting the skin and the hands and absorption. So a lot of disinfectants use alcohol as a solvent. Maybe they're using something else, but we don't want that being absorbed into the body. We still need to apply this standard to our disinfection process and make sure our employees are wearing the right PPE. Obviously, going back to your SDS that we'll talk about here in just a minute, and HAZCOM is going to be infinitely important to make sure that you're using the correct PPE. There have been some changes in the respiratory protection standard in 1910.134. OSHA has issued a temporary enforcement guidance that is applicable to all industry. I've included a link to the source document to the side on the slide, and everyone will receive a copy of this after the webinar, but I wanted to give that to you so that you could go back to it. And also we have a temporary enforcement guidance for healthcare. So Nathan, next slide, please. For the changes for all of industry, so OSHA has given us a ruling on extended use or reuse of N95s, recognizing that the supply of this very important piece of PPE is limited at the moment. They've given us the guidance of how to extend the use and how to reuse N95s. What you see on your screen, the quotation there, the citation, is directly from the source document. Feel free to read through that. I encourage you to, so that one, you're protecting your staff, and two, you're making the best use of your supplies and understanding that it doesn't, in the past we've had, you use it once and then you throw it away. It may not fall into that category now. The second part of the temporary enforcement guidance for all industry was the use of expired N95s. So you've had a box of N95s sitting in the supply room that's out of date. There's some guidance now, and again, in regards to the difficulty of obtaining these, that allows you to use those N95s that have an expiration date that's passed. And as you can see, CSHOs should exercise enforcement discretion for the use of N95 FFRs beyond the manufacturer's recommended shelf life, including surgical N95s. I think this is wonderful that OSHA is seeing this as for what it is, that it's a real problem and people are desperately trying to comply. And moreover, they're trying to protect themselves and their employees and running into some real difficulties. Again, guys, at the bottom of the slide, I've included a link to the source document. I do encourage you to go check that out. Nathan, next slide, please. So for the temporary guidance for healthcare workers, this applies to the healthcare industry only, and I want to make that distinction very clear. This enforcement guidance is about fit testing and things of that nature. That does not apply to all industry. It only applies to the healthcare industry. I've had some questions over the past week about this, and it was a misunderstanding that no, we can't, if your employment staff is required to wear respiratory protection to protect them from chemical XYZ, you still have to follow that standard. This is only applicable to the healthcare industry and N95s. If you'd like to take a look at that document, I've included the link. But Nathan, next slide, please. The meat of that document is that OSHA field offices shall exercise enforcement discretion concerning the annual fit test requirement, as long as, and then there's a list of things that the employers have to do for healthcare. Again, this is only healthcare. And as Joe said, no, if we have anyone from healthcare on our webinar today, but perhaps this is something that will help you out. Next slide, please, Nathan. So under HAZCOM, so I'm going to focus in on store-bought disinfectants because this is coming up a lot now, maybe in a business that didn't routinely have a tremendous amount of disinfectants in their business. Now they're having to get several. And that is going to be, thank you for the change there. What I wanted to bring out was that OSHA has mandated, and this was actually mandated back in 1990, that if you have a store-bought household disinfecting chemical, or any chemical for that matter, that's in its original container, you are using it by manufacturer's guidelines as specified at the correct times, in the correct dosage, if you will, that you do not need to have an SDS form for that chemical. Some of the problems I could see with this is if we get someone that, real industrious employee, and we all have them, that goes out and he generates or creates a super backpack that you put 20 cans of Lysol in, and he's running through the office spraying everything every 5 minutes. Yeah, no, that one doesn't fall under this requirement. That's obviously not being used as recommended by the manufacturer or probably anyone that's sane. But this standard does apply to you, that you do not need to have your SDS as long as you are using in the original container as the manufacturer recommends, in the correct times and the correct dosages as recommended by the manufacturer. So we are also seeing an uptick in the use of do-it-yourself disinfectants. So if you're creating a disinfectant from a reputable source, that is going to be placed into a secondary container or a portable container. That container does to be labeled, and if you can find an SDS for that mixture, that compound, that behooves you to go ahead and have that on site. So I think that's probably going to be your litmus test on whether or not it is an official, legit recommendation for a disinfectant, is if you can find an SDS for what you've put together in the correct amounts. Obviously follow official recommendations for making this stuff. We don't need any Walter Whites out there trying to, mix bleach and ammonia together. That's a really, really, really bad idea. That generates this nasty stuff called phosgene gas. So make sure that we're doing things the way that we should. Nathan, next slide, please. So in bloodborne infection or bloodborne pathogen infection control, I'll just have to reemphasize, guys, people have to be trained. So if you are specifically assigning employees to do the actual training, or I'm sorry, cleaning of, excuse me, anything related to COVID-19, even though they may be using a household disinfectant, they still must be trained in the bloodborne pathogen standard. They also need to have the correct PPE for what they're doing. We've covered that. I've included some links here for you for the disinfection and infection control resources from the EPA and the CDC. So the link for the EPA gives you a list of approved coronavirus disinfectants, and the link for the CDC are the recommendations for disinfection and disinfection solutions. I encourage you to go look at both of those documents for both manufactured disinfectants and as well as ones that you can make on your own that are legitimate. Nathan, next slide, please. In the general environmental controls for controlling COVID-19, we're still using our risk management triangle here. So our number one thing and most effective measure is elimination of the resource. So what I wanted to do is illustrate some things that we're seeing, that most of us are seeing being done across all industries. So if we're working remotely, we're eliminating the hazard. We're physically removing the employee from the environment of our workplace where they could potentially be exposed. In substitution, this is when we have essential employees that must come to work in order to keep things running, but we restrict access into that office that only certain employees come in. So this would be a substitution example. Using physical barriers such as splash shields in front of cashiers, or maybe lines or boxes on the floor that help customers maintain a 6-foot separate social separation. Those would be engineering controls. So we're putting something in place that prevents, or hopefully prevents, the spread of the disease. Administrative controls would be exactly what Joe just described, and that's making changes to how we normally do business. So now, instead of we're only using isopropyl alcohol as a manufacturing process, now we're adapting that process and using it for cleaning and disinfection. Obviously, we haven't done that before, so this is an administrative control that's been put in place. Lastly would be your PPE, so face masks, gloves, gowns, etc. And I wanted to bring up, Joe touched on it for HVAC systems and air circulation. Obviously, in healthcare, this is a big deal with having to maintain either negative pressure rooms or laminar flow rooms, depending upon the disease process. But in your office, a consideration could be the application of HEPA filters if you have not already done so. This is one of those, and it falls directly in line with the triangle. Our PPE is our last line of protection. So with HEPA filters, there is no direct evidence that they absolutely will decrease transmission of the disease, but it is acknowledged that they certainly will not hurt. So that is something that you can consider, and there's a lot of discussion out there, and I encourage you to go and see if that applies into your setting. Next slide, please, Nathan. So let's talk about the boogeyman, the general duty clause. Ooh, we're all afraid of the general duty clause, and we've all probably heard someone refer to it as the catch-all. I'm going to encourage you, do not be afraid of the general duty clause. This is meant as guidance to us. It's meant as a way to encourage us to think about what we have to do to make our workplace healthy and safe for our employees. So I've included a link to the OSHA's Preparation for Workplaces for COVID-19. That is their official publication. If you're going by this document, you will meet the requirements of the general duty clause almost certainly, with very few exceptions of outlying cases. Please use and comply with suggested reasonable efforts from official bodies. If you're doing what experts tell you to do, you are complying with the general duty clause. And secondly to this is, guys, make sure you're documenting. Have a preventive and corrective and preventive action log for what you're doing for COVID-19. Keep a record. Anything that you're doing to affect the health and safety of your employees in regards to COVID-19, write it down. Document what it was, the 5 W's. Get it down there. That's going to bear fruit for you in the future, almost certainly. Next slide. So let's get into the thick one, recording and reporting. This one's hard, guys, and I think our friends from OSHA, if we were to ask them, they would probably agree with us. So the citations that I have on the screen are directly from OSHA, that our record-keeping requirements are under CFR Part 1904, and they mandate covered employees record certain work-related injuries and illnesses in the OSHA log. So this has become thick with COVID-19 because there's a maybe. We don't know where the employee was infected unless their job specifically requires them to be exposed to risk factors for contracting COVID-19. So in this, OSHA has provided us some guidance. Next slide, please, Nathan. So the first part of this was the case, a CDC confirmed case. So your employee must have a recognized positive COVID-19 test. Please understand that these tests are signs and symptoms driven. In other words, a healthcare provider has to prescribe this test. We can't have somebody mail order off a COVID test or us and bring you that result and say that they had a positive confirmed case of COVID-19. It has to be a recognized official positive. So also I want to bring this out that there may be a negative or a false negative. So quoting from the CDC, if you test negative for COVID-19, you probably were not infected at the time your specimen was collected. However, that does not mean you will not get sick. It is possible that you were very early in your infection at the time of your specimen collection and that you could test positive later, or you could be exposed later and then develop illness. In other words, a negative test result does not rule out getting sick later. I've included a link to you, or a link for you to the CDC's testing guidance. Please check that out, especially as you're dealing with employees that are going to be probably testing positive in the future. Next slide, please, Nathan. So is the case work-related? So in 1904.5b2, the illness is a common cold or flu. Note, contagious diseases such as tuberculosis, brucellosis, hepatitis A, or plague are considered work-related if the employee is infected at work. Obviously, COVID-19 is not on this list. However, I feel reasonable to suspect that it's going to fall into this category. Now, the problem is, do we know where the employee was exposed? So also in 104.5b3, how do I handle a case if it is not obvious whether the precipitating event or exposure occurred in the work environment or occurred away from work? OSHA's determination on this is, in these situations, you must evaluate the employee's work duties and environment to decide whether or not one or more events or exposures in the work environment either caused or contributed to the resulting condition or significantly aggravated a pre-existing condition. So to illustrate this, if you have an employee, you're a healthcare employer, and you have a nurse that works in the COVID-19 ICU ward, and they come down with COVID-19, it is reasonable to suspect that they probably contracted it as part of their work. As opposed to the picture that I have on the screen, you have a line worker who continuously works in solo environments. They don't even have a partner. They're not in contact with other people for their work. Their job is to scale these monstrous structures and play with electricity. Is it likely that they contracted this through their work? Possible, maybe, but I would say probably not likely. So hopefully what we're going to get in the near future, and I feel it's coming, again, to reiterate, our friends at OSHA are working this out as well, is a letter of interpretation directly pointed at COVID-19. Next slide, please, Nathan. You also need to meet the general reporting criteria. These are no different from any other injury illness on the work site or in the job that we're used to. So loss of an eye, hospitalization, death, days away from work, these are basic reporting requirements, and to this moment, those have not been changed. Next slide, please, Nathan. Guys, in closing, I've provided a list of resources for you here to other guidelines and regulations that you strongly should consider and do your due diligence to refer to. So, and the first one is the Center of Disease Control. I've put up their homepage. On their homepage are preventative measures, health guidelines, and probably the most up-to-date information data in the United States. Next would be the World Health Organization, and this is their homepage that gives us worldwide visibility on what's going on from a health status or a health standpoint for COVID-19. Not necessarily for the work environment, but it may give you some information to help you make decisions about what you're seeing in your work environment. It is the most up-to-date information for worldwide data. And I give you a link to the U.S. Equal Opportunity Commission, the EEOC. And this is the EEOC's stance, how the ADA is applied to COVID-19 in terms of can you legally take temperature measurements of employees? Can you report that? Can you record that? Those sorts of things. If you're trying to develop your processes about limited entry or looking at your employees coming into your facility, this would be an excellent resource to go review to make sure that you're doing what the EEOC is recommending. And lastly is from the Department of Health and Human Services, or the HHS. And excuse me, this is guidance in reference to HIPAA, or health information privacy. So there have been some interpretations and relaxation of some of the things in HIPAA as far as discussing transmitting or digital transmission and recording of healthcare information. Even for a standard employer, for my HR friends, this is definitely somewhere you want to go take a look. It's actually, I think, very helpful, some of the things they've done, but you certainly need to be able to converse about it. Guys, I hope that what I've given you today, although brief, has helped you along maybe in some of the decision-making processes that you're having, and maybe I hope I clarified a few things. I can't emphasize enough and encourage you enough, if you have a question, call your local OSHA representative. Here in South Carolina, I've had to contact our OSHA office several times. These people are wonderful. They are more than helpful, and they really do. When you're coming to them saying, I want to comply, I want to do the right thing, they are there to help you and will go to every extent. I can't encourage you enough. Activate those resources to help you work through some of these difficulties. Nathan, that's all I have. Thank you, sir.
All right. So we're gonna talk a little bit about some of the upcoming webinars, but also answer some of the questions that were submitted to us earlier. Before the rest of you start chiming out of our meeting, we do have a few webinars coming up. One of them is violence in the workplace. We've partnered with a local company, Proactive, to provide that training to you all in a webinar style format. We'll be releasing the date on that in just a little bit. We're also really happy to let everybody know that South Carolina OSHA has agreed to let us host a question and answer with them. So just like we did today, you'll be able to send us your questions. We'll send those over to our South Carolina OSHA representative, and they will answer them live during one of our webinars. Again, we'll be releasing the date for that coming up soon. And then we have another one, minimizing exposure while working. So before we close out our meeting, a few of the questions that were submitted to us. First one is, as an essential business, what are suggestions or what are other companies doing to keep COVID-19 out of their workplace? Guys, you want to answer that?
Joe, I'll start off on this one. So Joe gave a lengthy example of what he has done for a manufacturer. In the past month or so, I've been working with municipalities and the construction industry for trying to help them find their way through this. So a couple of things we've recommended, and thankfully these were in the early stages of this and were rapidly implemented. So we've seen some good effects from it. The biggest one is just assessing your employees. Who do you have to have working there? And the phrase essential employee has become very vogue right now, but really looking and saying, hey, do I have to have Ms. Sue here taking notes for a meeting, or is there another way we can do this so that I don't have to expose that employee? Who are my people that are keeping our civilization running? We need to protect them at all costs. They are the tip of the spear, and who are making sure that we can continue living life at a somewhat normal condition. Maybe you don't need to have them come into your office every day. Perhaps they should be on a callback status, but just really evaluating those things. In the construction industry, something as simple as, hey, everyone on this construction site, you have your own piece of heavy equipment. We don't swap equipment anymore. You're not jumping out using something but somebody else's bulldozer. You use the same piece of equipment each time. And if something does come up, an employee has to leave, get sick, or for whatever reason, that piece of equipment is disinfected before the next employee uses it. Clearly, this is not standard practice, but implementing that could make drastic changes. Recommending to our employees, hey, bring your lunch to work. Most of our restaurants, you're not going to be able to go into anyway, but limit how much you're getting out in the public. So if you don't have to go to the gas station, don't. Bring your lunch in, make sure it's non-perishable items and things that don't have to be cooked, so that we aren't having barbecues on the on the job site, so to speak. And also on construction sites, you have a lot of different trades and expertise there, but limiting the interaction with those contractors in different trades. Everyone right now, for the most part, understands that this is just a preventative measure. It's not personal. It's just something we've got to do to take care of each other. Joe, did you have anything to add?
No, sir. I think you pretty well covered it.
All right, guys, we're getting a few more questions coming in through the chat as well as the ones that were sent in earlier. So let's move on to the next one. I think TC, you wanted to answer this one. Can you put some emphasis on the health of health and safety, more health than before?
Sure. The difficulty with really getting on the health side of this is that our information changes day to day and in some cases hour to hour. Joe and I we like to think, we were really good at our job. We were very good medical practitioners, but we have both been out of practice for quite some time. We are not on the front lines. So I'm very hesitant to give facts and information that are relative to immediate health concerns. I would refer back to official bodies, the CDC, maybe even give your local physician or your healthcare physician a call and ask your questions directly to them. But I would go directly to those sources. I wish that we could expand upon that, but that's just not in our wheelhouse for what we're doing right now. I apologize.
All right, next question. Since it's not known if someone can get the virus a second time, do we need to continue extreme cleaning when we return to work?
Nathan, I'll take a stab at this, and TC, you can fill in if I miss anything. So if you're following current literature, news, science journals, etc., there is a interesting, not only expression of the disease, but seemingly repetition of the disease amongst patients who have already potentially recovered, or at least apparently recovered. It's not exactly known why. It's different in different places. So how do we react to something that is an unknown threat and you're just not sure if it's going to work or not? Generally, you apply a little bit of overkill, and that means continue the thorough cleaning. So again, something TC explained earlier about this type of pandemic is it will come in waves. The fact that everybody is supposed to go to ground right now and isolate will help the healthcare system from becoming overwhelmed right now. But once those people come back out and start to interact with other folks, infections will probably increase. At least that's the theory at this point. So again, with COVID-19 and having a week or more perhaps of infectious yet not symptomatic time as a person walking around, with folks that don't know they have it, there are carriers who never become symptomatic but can spread it. I just think the new normal is very careful cleaning. It behooves you to just do it. It's I mean, other than maybe bleaching your surfaces and losing some color, I think it's worth it in terms of safety. The changes in procedures, people will get used to that. As long as there's a threat, we have to protect ourselves and our coworkers or our workers. And I just think that continuing the cleaning processes and the adaptations we've done is just going to be the way it is.
All right, our next question. Everybody on Facebook is a mask expert. Since the N95s are unavailable, would the homemade 2-layer form-fitting cloth masks be the best fallback?
Nathan, I'll answer this one. I think that if you're using the homemade 2-layer cloth method, that is perfectly fine for personal use. Just being careful, do not confuse this with the respiratory protection requirement from OSHA. If OSHA says you've got to wear an N95, you got to wear an N95. And if those are not available for that procedure, then other things have to be looked at as far as that process or procedure. There's varying degrees of opinion on, is it effective to wear a mask, is it not? I put this in the category of the HEPA filters for your HVAC. There's no evidence that shows 100% that it works, but there's also no evidence that shows that it doesn't. And reason would stand that it doesn't hurt. But I think it would be totally acceptable to use those on a personal level, but bringing them into a workplace, that's one that I think we're going to have to wait for some more interpretations or guidance from OSHA on that one, because right now it is as the respiratory protection standard states.
Nathan, I have a little bit to add in addition to what TC said. The material that is chosen for the mask is pretty important, as is how well it fits and the setting that it's used in. Everybody on Facebook is an expert, like the poster said. Man, if you look at Facebook or YouTube, there's some pretty squirrely stuff going on. I watched a video on the recommended procedure for turning a HEPA filter vacuum cleaner bag into a face mask. And it looked good, but the manufacturer strongly recommended against it. Other people were pointing out the ridiculousness of trying to adapt something like that to a living, breathing person, a two-way breathing process, and not just a machine sucking air or pushing air through it. You got to use some common sense and some careful skepticism when viewing these potential solutions or workarounds.
All right, it looks like our last question is, do you recommend someone who has tested positive for COVID-19, but who has gone through the 15-day quarantine period, should they get tested again before returning to work?
Nathan, I'd like to start that one off. I'm going to say on this one, through the CDC's recommendations, this is not a recommendation for return to work that I'm aware of. If someone had an initial positive test and they went through their recovery period and met the terms that the CDC has placed for return to work, I don't know that a second test would be necessary. Again, I haven't seen any official recommendation on this, but my gut feeling is that it would not be. Now, clearly, an employer can make that decision. That's above and beyond. But I do encourage thought to our testing process right now is limited and needs to be reserved for those that absolutely need it. So if we have a workforce of 300 people that have tested positive, and before we let them come back in the door, that's 600 tests that we've taken out of circulation, and that's 300 people that may desperately have needed it that didn't get it. I would strongly consider that before making this a recommendation for return to work.
And as addition to the point that TC made earlier and what he just said, it might be difficult for an employer to mandate a follow-up test if that follow-up test can only be done through a doctor's prescription. Trying to get your employee to convince a doctor that, by the way, I'm healthy, I'm okay, but I need to prove this to my employer, that the doctor's probably going to say thanks, but no thanks. Again, it's going to be a case-by-case basis, but we're all blazing new trails now.
All right, well, that was the last of our questions. Thank you, everybody, for joining our webinar. This webinar has been recorded. It will be distributed just like the last one was in video format. We also have the PowerPoint that you've been looking at that will be distributed to all of the attendees as well. And just be looking to your email for the next few webinars coming up, our Violence in the Workplace, the South Carolina OSHA question and answer, and then the COVID-19 minimizing exposure while working. Thank you again, everybody. Be safe and stay healthy out there.